As cold and flu season gets underway, there are concerns about low vaccination rates here in Northeast BC. And we've already seen the problem this year with the overwhelming number of measles cases in British Columbia coming from our region. In some cases, vaccine fatigue is to blame, while there's also misinformation being spread on social media. Now, one medical expert says that could compound the problem with influenza and COVID-19 heading into the winter. Noah Abel has the details.
It's autumn here in the Peace region, and that means cases of illnesses like influenza, RSV, and COVID-19 are on the rise. The respiratory illness season usually peaks between the months of November and April. So far this year, medical experts say COVID-19 is circulating at a normal pace across the province, but the flu and RSV have yet to pick up.
Well, COVID's been on the rise since the end of August, and we're seeing a number of cases, increasing the rate of positivity at testing. It's very early for RSV. Flu, we haven't seen very much activity as of yet.
Northern Health says these viruses can cause serious health risks. Every year, the health authorities say about 1,400 people across BC die from the flu and complications such as pneumonia. Medical Health Officer Dr. Raquel Kling says people need to make the decision that's best for them when it comes to vaccination. However, she adds getting immunized is very important, especially for people who are at high risk of developing serious health issues.
We do see severe outcomes every year, and it's especially important for people who are at high risk for severe outcomes, like people who are elderly, people with chronic conditions, children and pregnant women, to get vaccinated for COVID and flu.
Northern Health has rolled out its immunization campaign for the season, but an infectious disease specialist says vaccination rates in Northeast BC have decreased at a fast pace since COVID-19. Dr. Brian Conway says there appears to be more vaccine hesitancy in the northern part of the province. He says it's partly due to a sense of fatigue after multiple vaccinations during the pandemic.
This new culture where vaccines are not given the importance that we once gave them, and it leads to lower vaccination rates.
Dr. Conway says vaccine fatigue has been generalized to other viruses, which is a mistake. He says right now is the perfect time to get vaccinated before the spread of flu and COVID-19 picks up.
It certainly has the potential to be a huge problem going forward because vaccines have changed the face of the world and we're not telling that story enough.
But one of the stories Dr. Conway says is being told is the higher rate of measles cases across Northeast BC. According to the BC CDC, our region is responsible for 71% of all measles cases across the province, and that's because of low vaccination rates. Dr. Conway says we may see higher cases of flu or COVID-19 across the Northern Health region this year. That's for the same reason. Noah Abel, CJDC-TV News, Dawson Creek.